7. All prescriptions come with appropriate warning labels. False. Try not to laugh on this one, but it's false. First of all, did you ever notice that every prescription has like 100 side effects, and while you're reading it, halfway through you kind of fall asleep? Second of all, there's no informed consent, meaning you have to sign a document or something to acknowledge you understand the risks for risky drugs. They have these informed consent for other drugs, but not for fluoroquinolones. So, 3. There is no label on the prescription or the little pamphlet that comes with the bottle that says black box warning. And lastly, the side effects listed on the pamphlet do not accurately describe adverse effects. They describe side effects. And while many side effects are listed in the pamphlet, the individual adverse effects that exist within fluoroquinolone-associated disability and the particular constellation of symptoms across organ systems is not listed. There is a huge disconnect between the FDA, the medical community, and people that are suffering from fluoroquinolone toxicity syndrome. 8. All drugs come with a risk. True. However, this isn't really a fair statement when the drug is not prescribed correctly. So as you can see in this little screenshot, healthcare professionals should not prescribe systemic fluoroquinolones to patients who have other treatment options. That's too many fingers. 9. And this one's very controversial. Fluoroquinolone toxicity is rare. False. Even the FDA acknowledged that the numbers are underreported because 1. They use a self-reporting system to capture adverse effects. Self-report. You have to report it. 2. They admit their FAERS data system does not contain accurate data. They actually admit that. 3. There aren't any ICD-10 codes yet, working on it, to capture those adverse effects. In that case, it would be well documented every time someone went to the hospital or to see a doctor. And number 4, toxicity doesn't occur right away. So some people don't even realize they've been harmed by a fluoroquinolone or floxed until months later or even ever. The current estimate out there, wherever it came from, is that fluoroquinolone toxicity affects approximately 1 to 2% of the population. Let's explore this little statistic. In 2019, the medical director of Bayer said, up until that point, the total combined use of fluoroquinolones was 800 million worldwide. 800 million. So if we want to be very conservative and just use that 1% number, that's 8 million people. That's data from 2019. There are other doctors that treat patients with fluoroquinolone toxicity syndrome that state they believe the accurate numbers are more 10 to 15%. In any event, one can argue that the number of people harmed by fluoroquinolones is presumably small, and that these adverse effects may be rare in percentage terms, but frequent in absolute numbers due to the enormous quantity of prescriptions. 10. If fluoroquinolones were that dangerous, they wouldn't be on the market, right? False. A 2015 report by the FDA showed a list of disabling drugs, and wouldn't you know that the top 6 disabling drugs were fluoroquinolone antibiotics? Additionally, since the 1980s, there have been many fluoroquinolones that have been taken off the market. This further proves their destructive capabilities.